In podcast episode 74, I had an insightful conversation with Dr. Erik Thoomes on the topic of cervical radiculopathy. Erik is a practicing physiotherapist with over 40 years of experience. He completed his PhD in 2024 at the University of Birmingham in the UK and has published several papers on neck pain with an emphasis on cervical radiculopathy. He holds a Bachelor of Science in Physiotherapy, a Master of Science in Manual Therapy, and a Master of Science in Sports Physiotherapy. He has taught undergraduate and postgraduate physio students with a focus on clinical reasoning and motor control dysfunction. Erik explained that cervical radiculopathy is a specific yet non-serious disorder caused by irritation or compression of a cervical nerve root. Unlike non-specific neck pain, which lacks a clear cause and is influenced by various contributing factors, cervical radiculopathy is often characterized by neuropathic pain radiating into the arm, often accompanied by periscapular shoulder pain, upper limb paresthesia, and muscle weakness. The most common underlying causes include cervical disc herniations and narrowing of the intervertebral foramen due to spondylotic changes. Discussing its prevalence, Erik noted that research in this area remains limited. The primary reference point continues to be a population-based study conducted in Rochester, Minnesota in the 1970s. This study estimated an annual incidence of 107 per 100,000 men and 64 per 100,000 women, with the highest occurrence seen in individuals between the ages of 50 and 60. Erik emphasized the need for more contemporary research to better understand the condition's epidemiology. When it came to diagnosis, Erik stressed the importance of a thorough patient history. The key indicators of cervical radiculopathy include more severe arm pain than neck pain, neuropathic symptoms such as tingling, numbness, and sharp shooting sensations, muscle weakness, and a clear relationship between symptoms and specific neck movements or postures. However, differentiating this condition from similar disorders is crucial. He highlighted that referred pain from nonspecific neck issues, thoracic outlet syndrome, and even rare conditions like Parsonage-Turner syndrome could sometimes mimic cervical radiculopathy. He also advised clinicians to remain vigilant for red flags such as rapidly worsening neurological deficits, unexplained progressive muscle wasting, and atypical pain behaviors that might indicate a more serious underlying condition. Erik discussed the reliability of diagnostic tools, acknowledging that while high-quality evidence remains scarce, a combination of clinical tests improves accuracy. The most useful tests include the Sperling's test, upper limb neural tension tests, the shoulder abduction relief sign, and the arm squeeze test. He also emphasized the importance of neurological assessments such as myotomal strength testing, reflex testing, and sensory evaluations, including two-point discrimination. For treatment, Erik underscored the necessity of an individualized approach. He described a stage-based strategy, beginning with education and pain management in the acute stage. Patients need to understand that recovery typically occurs over 4 to 6 months, and avoiding provocative postures and activities is key. Pain management, including pharmacological options, when necessary, play a crucial role. Gentle neurodynamic slider techniques and, in some cases, the short-term use of a cervical collar could help alleviate symptoms. As patients progress into the subacute stage, Erik recommended motor control exercises to strengthen deep neck flexors and extensors. Activity levels could be gradually increased, and thoracic mobilization, along with safe manual therapy techniques, could be incorporated. In the chronic stage, the focus should shift to targeted strength training for weakened muscles, general aerobic fitness, and continued neurodynamic exercises when needed. On the topic of manual therapy, Erik strongly advised against high-velocity manipulations of the cervical spine as they carry the risk of further irritation. Instead, he advocates for thoracic manipulations and cervicothoracic mobilization techniques which aim at creating space within the intervertebral foramen. He also supports the use of contralateral cervical lateral glide techniques, which combine joint mobilization with neurodynamic mobilizations. Addressing exercise therapy, Erik highlighted the well-documented wasting of deep cervical flexors and extensor muscles in cases of prolonged neck pain. Because patients with cervical radiculopathy often fall into this category, retraining these muscles is an essential part of long-term management. Education and self-management are also central to Erik's treatment philosophy and recommendations in guidelines. He believes that one of the most powerful interventions is helping patients understand their condition and its natural course. He uses a log fire analogy to illustrate symptom management, explaining that an inflamed nerve root is like a burning log. If patients continue to engage in aggravating activities, it's akin to adding logs to embers, causing flare-ups. Understanding this analogy helps patients adjust their behaviors and expectations during recovery. Erik also discussed common mistakes in diagnosing and managing cervical radiculopathy. He warned against misdiagnosis, particularly confusing radicular pain with somatic referred pain or other nerve entrapment syndromes. He also cautioned against an over-reliance on traditional dermatome and myotome maps, noting their significant inter-individual variability. Furthermore, he discouraged passive treatment modalities such as cervical traction, dry needling, and kinesiotaping, stating that these lacked strong evidence for their effectiveness. Instead, he encouraged physiotherapists to prioritize active interventions, even though they required more effort and engagement. Looking toward the future, Erik highlighted several key areas for research. He emphasized the need for updated epidemiological and risk factor studies, as well as further investigation into the mechanisms of neurodynamic mobilization. He also called for a standardized approach to executing the Sperling's test and a better understanding of the diagnostic accuracy of commonly used neurological tests. Alright, this was a brief summary of podcast episode 74 on cervical radiculopathies with Dr. Erik Thoomes. I hope this raised your curiosity to listen to the whole episode, and if you would like to have more resources, download our Physiotutors app to listen to the podcast episode in your own language, and also get access to the transcript and infographics as a premium member. As always, thanks a lot for watching, and I'll see you in another video. Bye.